Dementia Researcher with a blog and a rating.
ENRICH, Enabling Research in Care Homes Scotland, works to ensure that care home residents, relatives and staff across Scotland have the opportunity to take part in research, regardless of where they live. As a clinical studies officer with ENRICH, my role is to support care homes to become research ready and to act as a bridge between researchers and care homes interested in participating in research studies. Alongside covering Aberdeen and Aberdeenshire, I also work with care homes in the Western Isles, Orkney and Shetland. Initially, I had concerns that engaging with island communities might be difficult. However, post-COVID ways of working have shown that meaningful engagement doesn't necessarily require face-to-face contact. With the right technology and a willingness to connect, distance quickly becomes less of a barrier. What has stood out most is how enthusiastic island care home staff are about research. They are keen to be involved, motivated to improve care for residents, and determined not to be left behind the times. With the right technology and a decent internet connection, all it really takes is someone willing to talk to you while sitting at their desk. The key word there is willing, and I have found staff on the islands to be very willing to not only hear about research, but to actually participate in it. I have been inspired by the commitment these care home managers and staff have to their residents and staff to ensure that quality improvement is ongoing, and that these homes are not left behind. There is recognition of the challenges faced, such as connectivity issues, travel issues, recruiting and retaining staff, and a limited pool of people, meaning that people can be teachers by day, carers by night, and even firefighters when needed. However, this doesn't seem to deter staff in care homes from wanting to get involved and go the extra mile for their residents. In late 2024, a care home in the Western Isles took part in a research project on music provision in Scottish care homes. Senior social care worker Marina MacLeod said, "Being able to be part of research programme in our remote care home was a great benefit to us and of interest not only to our staff but also to our residents who thoroughly enjoyed taking part. The outcome of this research has helped to shape the current activity package, which in turn has enhanced social interactions for our residents. It was lovely to see both residents and staff working together in this project, with staff learning from resident experiences and insights to have an active role in shaping their activity programme. It is clear from this summary that the time invested in this project was indeed time well spent." To use another example, ENRICH and some island care homes have recently undertaken a dementia training board game via Teams. An unusual experience from my point of view, to be part of a board game taking place in care homes on the Western Isles and Orkney while I am sat at my desk in Aberdeen. But it worked, and it saved us having to exclude sections of the population based on geographical location. This takes more organisation and collaboration than a face-to-face game, but thankfully we ensured that the home had copies of the correct paperwork and a copy of the game prior to the arranged date. We gleaned some valuable insights from working with the island care homes on the game. For example, the game highlights that people living with dementia who live in rural areas can have difficulty accessing care. The staff reflected that people on the islands can face a delay in diagnosis. Indeed, the community in Shetland even raised money to buy a CT scanner in an attempt to overcome delays in diagnosis, and that there is a lack of healthcare teams available, including psychiatrists and community psychiatric nurses. This echoes thoughts of an island care home manager who had previously voiced to me that care home staff on the islands are forced to have a wider knowledge base as they don't always have quick access to specialists. Importantly, this engagement also highlighted how rural and island communities can experience a more covert form of exclusion from research. While they are rarely excluded through formal eligibility or exclusion criteria, practical barriers such as travel feasibility, cost, and limited time allowances can make it difficult for the researchers to justify or fund work in remote locations. As a result, the voices of care staff and people living with dementia in these settings are often absent from research. This is despite the fact that staff bring wide-ranging expertise and first-hand insight shaped by limited access to specialist services and delayed diagnoses. These perspectives are not less relevant, but they are far easier to overlook when research designs prioritise convenience over inclusion. Island care homes also face unique challenges such as staff shortages linked to travel disruption during adverse weather. Nevertheless, staff remain highly engaged, travelling to attend events such as the most recent ENRICH conference, research workshops, and actively contributing to research discussions. For early career researchers in particular, there's an important lesson here. Rural and island care homes are not hard to reach because they lack interest or capacity. Rather, they require more flexible and creative research approaches. Virtual methods, hybrid designs, and collaborative planning can make inclusion possible and rewarding. By broadening how we design and deliver research, we can ensure that dementia research reflects the experiences of all communities, not just those that are easiest to access. The willingness, insight, and readiness of rural and island care homes makes them invaluable and well worth the extra effort if you engage them as research partners at the earliest opportunity. To conclude, I would like to thank our homes on the islands for being such willing participants in research. Thanks in particular to Amanda and Marina, who willingly gave up their time to speak to me regarding this article. I am grateful of the opportunity to work with the islands that has arisen, and this has allowed me to glean pockets of knowledge I would otherwise have been unaware of. If you would like help finding care homes in more remote and rural areas to support patient and public involvement and engagement to work with Cure Research, please get in touch with ENRICH Scotland.
Thank you for listening. Join the Dementia Research bloggers and share your own views.